Do you think sexual dysfunction in men only happens to the elderly or those with serious health conditions? Well, let's pause right there and debunk that myth. You see, this common misconception is one of the many untruths that surround the topic of male sexual dysfunction. It's easy to fall into the trap of thinking this way, believing that it's an issue only for those in their golden years or individuals grappling with severe health problems. But truth be told, sexual dysfunction does not discriminate based on age or health status. Let's be clear here. Sexual dysfunction can happen to any man at any point in his life. It's not exclusive to those over 60, nor is it reserved for those with chronic illnesses. In fact, studies have shown that men in their 20s and 30s can also experience issues with sexual health. The reasons for this are varied and many. Psychological factors such as stress, anxiety, and depression can play a significant role in sexual dysfunction. Lifestyle choices like excessive alcohol consumption or drug abuse can also contribute to this condition. And yes, certain physical health conditions such as diabetes, heart disease, or hormonal imbalances can lead to sexual dysfunction as well. So you see, it's not a straightforward age or health condition equation. It's a complex interplay of various factors, both physical and mental, that can lead to sexual dysfunction in men. And let's address another misconception while we're at it. Seeking help is not a sign of weakness. It's okay to speak up, to seek advice, to reach out for professional help. Because the truth is, sexual health is a vital part of overall well-being, and addressing any issues you may be facing is a step towards better health and a better quality of life. So it's time to set the record straight. Sexual dysfunction is not a selective condition. It can affect any man at any age. Let's cast aside these myths and misconceptions, and let's start the conversation on a note of truth and understanding. After all, knowledge is power, and understanding is the first step towards resolution. Sexual dysfunction in men is a complex issue with various causes. It's not a one-size-fits-all situation, but rather a multifaceted concern that requires a comprehensive understanding. So let's start with the basics. What exactly is sexual dysfunction? It's a term that encompasses a wide range of issues that prevent an individual from fully enjoying or participating in sexual activities. In men, these issues often manifest as difficulties achieving or maintaining an erection, known as erectile dysfunction, or ED for short. But ED isn't the only form of sexual dysfunction. There's also premature ejaculation, which is characterized by an inability to delay ejaculation, often resulting in a sexual encounter that ends sooner than both partners would like. Another common form of sexual dysfunction is decreased libido, or a lack of sexual desire. This can be particularly distressing because it can affect not only the individual experiencing it, but also their partner and the relationship as a whole. It's important to note that sexual dysfunction is not an isolated issue. It's a widespread problem that affects millions of men worldwide. According to the Massachusetts Male Aging Study, about 40% of men are affected by erectile dysfunction at age 40, and this number increases to about 70% by age 70. That's a significant portion of the male population. And remember, this is just one form of sexual dysfunction. When you consider other forms like premature ejaculation and decreased libido, the numbers are even higher. The good news is, acknowledging and understanding these problems is the first step towards addressing them. By recognizing that sexual dysfunction is a common issue, we can start to break down the stigma and silence that often surrounds it. We can encourage open conversations about sexual health and promote a more comprehensive understanding of these issues. Remember, sexual dysfunction is not a sign of weakness or a lack of masculinity. It's a medical condition just like any other, and it deserves to be treated with the same level of understanding and respect. Understanding sexual dysfunction can help in addressing it efficiently and effectively. A myriad of factors can contribute to sexual dysfunction in men. To start with, let's discuss the physical causes. Heart disease is a major player in the world of sexual dysfunction. It can restrict blood flow to the penis, making it difficult to achieve an erection. Similarly, diabetes can damage nerves and blood vessels, leading to problems with erectile function. There's also the issue of hormonal imbalances. Testosterone, the hormone responsible for sex drive in men, can decrease with age or due to conditions like hypogonadism. When levels of this hormone drop, it can lead to decreased sexual desire or even erectile dysfunction. Neurological disorders, too, can play a role in sexual dysfunction. Conditions like Parkinson's disease, multiple sclerosis, and stroke can interfere with the nerve signals necessary for sexual response, causing problems with arousal or orgasm. Now let's shift the focus to psychological causes. Stress, anxiety, and depression can all wreak havoc on a man's sexual function. These conditions can create a vicious cycle. The anxiety or depression can lead to sexual dysfunction, which in turn increases stress and anxiety levels, further exacerbating the problem. Relationship problems also come into play. Conflict with a partner, lack of communication, or unresolved issues can lead to sexual dysfunction. It's important to remember that sexual health is not just about the physical, but also about the emotional and psychological. And then, of course, we have lifestyle factors. Excessive alcohol and drug use can negatively impact sexual function. Both can lead to issues such as decreased libido, erectile dysfunction, or difficulty reaching orgasm. It's clear to see that sexual dysfunction can stem from a variety of sources, both physical and psychological. It's a complex issue intertwined with many aspects of a man's health and well-being. But remember, it's not an insurmountable problem. Identifying the cause is the first step towards finding the right treatment. The effects of sexual dysfunction extend beyond the bedroom. It's not just a physical issue, it's a mental and emotional one too. It can cast a great shadow over a man's mental health, leading to feelings of embarrassment, frustration, and even shame. These feelings can snowball into more serious mental health problems like anxiety or depression. The impact doesn't stop at the individual either. It can also strain relationships, leading to misunderstandings, conflicts, and even breakups. It's important to note that sexual dysfunction isn't just a man's issue, it affects partners too. The overall quality of life can take a hit as well. A man suffering from sexual dysfunction might start to withdraw from social activities or lose interest in things that once brought joy. The ripple effects are deep and wide-ranging, but it's crucial to remember. The ripple effects of sexual dysfunction can be profound, but help is available. Facing sexual dysfunction is challenging, but not insurmountable. Indeed, it's a road laden with difficulties, but numerous coping strategies and treatments can help you navigate this journey. Let's start with some of the most common treatment options. Medications are typically a first-line approach. These can include prescription drugs such as phosphodiesterase type 5 inhibitors, which work by improving blood flow to the penis. However, it's vital to remember that while medications can be effective, they are not a one-size-fits-all solution and may not be suitable for everyone, particularly those with certain health conditions. Next, counseling and therapy come into play. This can be individual therapy, where you discuss your concerns and feelings with a professional, or it could be couples counseling, where both partners work together to address the issue. This approach can help to resolve any psychological barriers to a healthy sex life, such as stress, anxiety, and relationship issues. Then, there are lifestyle changes. Maintaining a healthy weight, engaging in regular physical activity, quitting smoking, and moderating alcohol intake can all contribute to improving sexual function. These changes not only enhance your overall health, but can also boost your self-esteem and reduce anxiety. Surgical interventions, although less common, are another treatment option. These can range from vascular surgery to penile implants, depending on the cause and severity of the dysfunction. Remember, this is typically considered only when other treatment options have not been successful or are not suitable. It's essential to encourage open communication with partners about sexual dysfunction. It may feel uncomfortable initially, but discussing the issue can alleviate stress, promote understanding, and foster intimacy. Above all, seeking professional help is crucial. Healthcare professionals can provide a thorough evaluation, discuss treatment options, and support you throughout your journey. Remember, there is no need to suffer in silence. Reach out, seek help, and regain control over your sexual health. So, what have we learned today about sexual dysfunction in men? We've tackled common myths, grasped the understanding of sexual dysfunction, explored its causes and effects, and discussed coping strategies and treatments. Keep in mind, sexual health is an integral part of overall well-being. Don't hesitate to seek help when needed.